The hospitalizations, as you were saying, that and ICU admissions sometimes can give us a bit more idea of actually what's happening rather than infection rates itself. What is happening at the moment in the hospital system, and is there going to be a scale up going forward given this apparent surge?
It is not just an idea. I think it is the most important metric now to watch, which is how many beds are taken. ICU, 20 beds is not a big number. So what we are worried more are hospital beds. 600-700 is out of a system of 10,000 beds is not a small number. Imagine adding 6-7% utilization. It does add considerable workload on the system. And I think the world over is facing the same challenge post-COVID. Somehow there are just many more patients, especially old patients with many complex issues, comorbidities, they're all coming forward, needing quite long stay in hospitals. Every country is facing that post-COVID. It's just a new era, so we have to watch that. And as you say, we need to really watch the capacity expand where we can, which is what we are doing.
Minister, I have to ask you, this whole thing about getting more shots, right, and vaccines themselves. And, you know, as far as the government goes, obviously they wouldn't offer anything, free or not, if it were not safe to the public, right? But over the last several months, there have been reports, and I want to know what you make of this. There have been reports about the efficacy of some vaccines, including the Pfizer one, right? That they may actually indeed, for some demographics, not be safe, pregnant women among other things, right? Then there have been other reports also that, you know, Pfizer's been naughty and they've been experimenting and mutating the virus themselves to try and get a head start on the next type of vaccine to develop. Is this just all conspiracy theories?
Lots of conspiracy theory.
Is that what it is?
We all know.
You've seen these reports, right?
We've seen these reports. I would say I see many more reports on the efficacy of vaccines than these conspiracy theories, because I work in a scientific environment. We read reports like that all the time. We know for sure. Singapore came out of COVID not too badly. We registered, even though we are an urban city, we registered one of the lowest excess deaths in the world. And we know that it's largely due to the fact that take-up of vaccines is very strong. And that really protected us. Vaccines do work. We have to be mindful of a few things. Number one, vaccines do not prevent you from infection. Yeah, not this vaccine. You will get infected. Vaccines prevent you from getting hospitalization. And this is especially important if you are a senior, 60 and above, or you have some underlying chronic illnesses. So you are vulnerable, you need to take the vaccine. You should take it about once a year. Yeah. We have been very transparent about the side effects of vaccines. Most side effects is slight fever, a sore arm, some fluish symptoms. There is a group which we review. We used to review this every quarter. For younger males, there is a tendency to get myocarditis, which is a swelling of the heart, which they do recover by themselves mostly. But by and large, these are the predominant risk. But the benefits, especially when we go into 2024, I think it's going to be tremendous, because if you don't take the vaccine and you're a senior, your antidote is going to wane. And the next wave that comes, it may hit you hard. So take the vaccine before it comes.